Good morning to you. Welcome to hour number 2 of the Art Lewis Show on this Monday morning, 29th of December. Talk a little health this morning. We're going to do that with the Saginaw County Health Officer. Returning for another visit, we say good morning to Christina Harrington.
Good morning, Art.
Good morning. Good to see you.
Thanks for having me.
Wearing her Be Well Saginaw sweatshirt. We'll get into that.
Good.
I might as well get it out of the way up front. You know what? We were talking about it anyway. There is an enormous amount of news controversy about vaccines. And the thing that worries me, as I was expressing to you, I understand if there's controversy about the COVID vaccine, so be it. But when we start bringing into this fold polio vaccines, rubella, measles, mumps, all of those things that youngsters have been getting for millennium to go to school, that's worrisome. Where are we with it? What do you make of it?
Yeah, it's definitely an interesting time. I think what's important is people need to remember that we have eradicated disease from the planet because of vaccines. And I think it's difficult in the generation we're seeing right now, questioning science and making sure that what we're doing is, safe and effective. No one's ever said that vaccine is the only cure or the only tool to stop the spread of disease. We didn't say that during COVID. It was all about tools in the toolbox, and vaccines are that. I think it is a slippery slope, and when we start to question everything that we've ever thought about in terms of interventions, that we likely will see a reemergence of diseases. Our generation, my generation now, I didn't have to worry about polio and diphtheria because we got vaccines when we were kids, and people don't see those presentations. So we just sort of think like it's not a big deal, or that it's not going to happen or reemerge, but it will. I mean, that we have seen the reemergence in communities where vaccination rates are low. Saginaw does well in vaccination rates, so we haven't seen it like we have in other communities.
What is the state law on vaccines for school children?
So it's still, Michigan still has
it's a mandate?
Mandates for school-based vaccinations. Not to say that you can't get a waiver to be unvaccinated. Right. And so there are still processes in place for parents that wish to not vaccinate their children, and the process for going through a waiver to do that. So it's still a choice, and it has been a choice. So I think we're getting stuck in semantics here about required and not, and I think people are generally feeling like, don't require me. But we actually don't right now. We just want people to be educated around the risks and benefits for all vaccines.
Would you ever see the state removing those mandates?
I think that would be a tough push to do, although we are seeing obviously some communities in some states that are sort of looking to step back on all of those things. I think it's hard to say, it's just where the political push going to happen. I hope that it doesn't. I think that vaccines are a good tool in the toolbox to have. And, this idea that we talked about and people became educated on during COVID, like herd immunity, like the more protection we have, the less the disease circulates.
The other thing we've heard in recent years anyway seems to be a bit of an onset of measles.
Mm-hmm.
And we have a vaccine for that, don't we?
We do.
And one of the reasons there was an onset is the reduction in youngsters getting vaccinated, I assume.
Yes. So in communities where vaccination rates are lower, measles is a great example of how we've seen a reemergence of something that we haven't had to deal with in decades.
The only question I have, and I think it's a legitimate question, those vaccines that we have had forever, were put through the ringer and took years and years to come to the market. Starting with the COVID vaccine, it was a very accelerated process. Now, and I've said this before too, the RMNA, the delivery system was on the books for 6 years before the vaccine came along, and all we did was inject the virus component into the delivery system. But still, it seemed it came to the market in a hurry. Mm-hmm. That seems to be part of the issue today.
Mm-hmm. Yep, absolutely. I think so. But because of the way that COVID was manufactured, we shouldn't then question
everything else
and the long studies around the efficacy and the safety of those other vaccines, because we have literally decades and decades of data. Is there any? I don't think you would talk to a physician or providers or informatics and epidemiologists that would say, as we study not only disease transmission but also the safety of the vaccines, that are there never any adverse events? No. I mean, there are adverse events to anything that you do.
Some people will have a reaction.
Some people will have a reaction. But there's, again, decades of data where we've tracked those reactions through adverse events. And you start to study those things, and do we see them on a population level affecting, hurting, doing more harm than good? And the answer to those other vaccines is no, we're not. We're seeing the results that we've been seeing for decades, and stopping the spread, eradicating some diseases like smallpox does not exist on this planet because of vaccination efforts.
Yeah. And it seems to me, too, that, if you have, I'll pick a number. If we have 100,000 people and 5 of them have a reaction to a vaccine, all of a sudden we have to pull the vaccine. Well, wait a minute. That's not logical.
No, it's not. I mean, part of it is you're trying to do the greatest good for the greatest number of people. Not saying that this is an absolute, that 100% of the time no one has a reaction. That's just not how medicine works.
Well, medicine is a science and an art.
Correct.
And that's why doctors practice medicine.
Absolutely. Absolutely.
When you look at it that way.
Yes.
All right, we're going to take a break, come back. We're talking to Christina Harrington. She is the Saginaw County Health Officer at Saginaw County Health Department. Talk about some other things.
Christmas.
Show in studio with me, Christina Harrington. She is the Saginaw County Health Officer at the Saginaw County Department of Public Health. And I don't know if I ever asked you this. What is the job of the health officer?
No, I don't think you ever have, actually.
I never have.
Yeah. So, I mean, obviously running and managing the health department and all the services we provide, some of which are mandated in the Michigan Public Health Code. So Michigan's system is really run because we've created law that says this is what local health departments do. Things like we investigate the disease in our community. So a health department's the only one that does that. If you walk into the hospital and they know you have disease X, Y, or Z, they're there to treat you individually. But we're looking at when, the spread in a population. So, of course, people recognized us during COVID because we were investigating the spread of that disease.
If somebody walks into a hospital with one of those communicable diseases, is the hospital required to report that to you?
Yes. So every provider. So no matter where you go, if you get tested, whether it's E. coli or if it's, it could be a foodborne like Giardia, Salmonella, things like that. You could go anywhere to your provider's office or into the hospital. Anytime that they're an individual as a Saginaw County resident is tested for a communicable disease, it gets reported to the health department. And then we have nurses that are looking at that to see, are we seeing a bunch of cases of disease X, Y, or Z? And then if we think we have an outbreak of that disease, then we go into an investigation to figure out the scope of that and how do we stop the spread, things like that. So we get a lot of sometimes self-reported calls too. So people, of course, love to call the health department when they think they ate at a restaurant that they think made them sick.
Yeah, we're going to get to that.
And so we take those, and because sometimes that, could be a mechanism. And so we say, a bunch of people. Wedding receptions, sometimes we get called about. And if there's a bunch of people and they have similar signs and symptoms and we can link them epidemiologically, don't live in the same household, then that's where we start to say, okay, maybe we have an outbreak of something, and we go in and investigate that.
We should explain one of the responsibilities of the health department is restaurant inspections.
Yes. So other pieces around communicable disease, and it's really about like safe food handling so that we don't have an outbreak of disease. So our sanitarians go out and inspect all of our food service establishments and restaurants, whether that's the mobile food trucks or the brick and mortar restaurants. And so we're out there doing inspections to make sure that they're handling their food safely as possible so that they don't make their patrons sick.
And that, that also goes for businesses that may have a one-time event where they're serving food on premise.
Yes, also temporary food. So
I've been involved in a number of those. Had to deal with your
pancake breakfasts and things like that, right? Yep, absolutely. Those community events. Anytime we're serving food to members of the public, that's when our sanitarians are to help educate and do their inspections.
Just as a general statement, are the restaurants around here doing pretty well?
Yeah, we definitely take a lens of education. So, everyone, of course, is like, when's my inspector coming, as a food service? And, they're obviously on their best behavior the day that we get there. And our inspections are a point in time. So people are always ask me and ask our staff, should I eat at restaurant X, or where shouldn't I go? And so it's really not just about that a point in time inspection. It's really about how the restaurant, treats the culture of food safety. And our sanitarians are very much there to help educate. So when we go in and we see things, it's about, hey, let's make sure that we're doing what we can so that you don't. I mean, no restaurant owner wants to make their patrons sick. I mean, that'll take you out of the restaurant business, right?
Real quick, yeah. So just out of curiosity, there was a day when we could call Michigan State Extension as a homemaker and ask questions about food safety and things of those nature. If a sanitarian goes into a restaurant and opens up the refrigerator, food has to be stacked a certain way so the contaminants don't run down the hill, so to speak.
Right.
And it's probably a good idea to pack your refrigerator at home the same way, but most people don't know how to do it. Can they call you and say, how should I load my refrigerator?
Yeah, absolutely.
Simple little thing like that?
Yep, absolutely. We've done videos in the past, and I think we've done some educational. If patrons and residents want to know, absolutely, anything relative to food safety, we usually try to do as much education as possible. So they absolutely can call and ask those questions and talk to a sanitarian who could tell them everything from what's smart food practices for your refrigerator, to also like thinking about, as we're getting into the soon-to-be holiday season, we have lots of food gatherings with family. And it's important to know, like, let's not cut up the chicken and then cut the vegetables on the same surface we just cut the chicken with. And some of those things seem, sort of common sense, but there's a lot of practices that people, we learned how to cook from our grandmothers and maybe great-grandmothers or whoever, and sometimes we do things and we don't always know why we're doing them the way that we're doing them. So there's always opportunity, I think, to be more educated in food safety, and our sanitarians absolutely love to talk to anybody about that.
Yeah, I always thought if I were going to build a kitchen, I'd have the 3 sinks side by side, but nobody does that in their house.
Right. Nobody's got 3 compartment sinks. We're not doing wash, rinse, and sanitize. Usually, if you're hand washing, it's the hot soapy water, you rinse and you're good. So it's a little different as we think through those kinds of things. But, basic sentiments like, if you don't feel good, don't make Thanksgiving dinner for, 20 of your family
Stop
members.
breathing on the turkey.
Yeah, those are all similar practices. Yeah.
It's funny because when my wife passed, I've told everybody you really learn about what your wife does when she's not there anymore.
Right.
And all of a sudden the dishes pile up, and for a long time I was hand washing them, and I have a dishwasher sitting right there. I really came to realize the dishwasher was much more efficient at it than I was, and did a much better job.
Yes, and does a much better job on the sanitizing part of it, right? That is the benefit of a dishwasher.
You kind of come to terms with that,
Yeah,
But
absolutely.
safe food handling is really important because, man, I'll tell you, there's nothing worse than getting food poisoning. Oh,
Yes.
that can really tear you up.
Yeah, and it's and not even just food poisoning, but just the transmission. Like norovirus is one, or what most people know of it as the stomach flu, right? Well, there is no flu in your stomach, but we call it the stomach flu. But it's really something called norovirus. So when people are, it's coming out of both ends, and it happens for 24 to 48 hours. And people think sometimes it's like, oh, that's food poisoning. But that also is very transmissible, and it can be transmissible through things like, silverware or just handling of items. And so early on in my career, in doing outbreak investigations, there was a restaurant down in the Lansing area, and it was a college student who wanted to call in sick, but the restaurant was short-staffed that day. So they made the college student come in thinking, oh, you probably just have the brown bottle flu from the night before. And so they knew, well, we're not going to put him in food prep, but we'll have him wrap silverware. And so there was 600 people that got sick.
Oh.
Yes. As one individual, he would go to the bathroom, he was sick, he'd come back, and he'd wrap more silverware. Very large outbreak
Didn't
that
wash his
happened.
hands either.
And so probably not, but norovirus is very contagious that way. So not only just from food poisoning if we don't cook the food at the right temperature, but also if we're sick and we're handling things that then people can also transmit
We
disease.
hear a lot about that on cruise ships, don't we?
Yes. Norovirus was the quote unquote cruise ship disease. And so because it is very easily transmitted and can be through common surfaces, obviously food practice and food handling. Yes.
All right, we're going to take a quick break. Come back. We're talking to Christina Harrington. She is the Saginaw County Health Officer at Saginaw County Department of Public Health.
It's natural to have questions.
Christina Harrington, the Saginaw County Health Officer. And I got to bring these up because Saginaw County, for a long time, had a pretty bad reputation in a couple of areas. Mm-hmm. One of them was infant mortality. The other is obesity. So let's take those one at a time. Infant mortality. Have we made any strides in reducing those numbers?
Yeah, we're seeing some really great work happening in this space. So part of the health department, going back to your question earlier about what does a health department do, we're also conveners around health issues, right? So we study population data, and we say what gaps exist in our community and what are we going to do about them. So we formed a coalition a couple of years ago and sort of reinvigorated and gave it a name and identity called Be Well Saginaw. And this is a group of 13 organizations that are working collaboratively together to address those issues. So for longstanding, we've had high infant mortality rates. So our babies in Saginaw are dying at higher rates than most other communities across Michigan. And we're losing far too many of them. And the work of this coalition said, we really need to, one, raise awareness about our problems, and then work across organizations to do something about that. And so in infant mortality, one of our main partners, CMU Health, said, we want to create sort of one voice about how we're going to educate moms and the community about unsafe sleep. So we know we lose far too many babies. Some of them are due to, extreme prematurity, low birth weight, right? Those are just babies that don't survive. They have a poor birth outcome, that don't make it. But we have a large number of our babies who go home with mom and dad, they're thriving, they're healthy little individuals, and we lose them due to unsafe sleep practices. So we put them in unsafe sleep environments, so they, asphyxia, all kinds of situations around what's happening, and the baby dies. Those are 100% preventable, right? So these are not babies that are just sickly and don't make it. These are babies that were thriving that should be with us. So we said we need to do a better job because far too many of them were dying because of unsafe sleep. So we need to educate moms, families, dads, grandparents, and the community as a whole needs to understand what is a safe sleep environment. So we created a campaign called the ABCs of Safe Sleep. A, alone, B, on their back, and C, in a crib or a pack and play or a safe sleep environment. And all of our partners said, we're going to do a better job and we're going to speak with one voice. So we keep hammering down the ABCs of safe sleep. So whether you go to CMU and you're at a clinic there, or we're working with some of our faith-based and churches to do some education and awareness out in the community, or you're at the health department, or you're at Great Lakes Bay Health Centers, or you're at Covenant, these moms are now seeing the messages around ABCs.
So it's a universal message.
Universal message, one voice, and we're seeing incredible results. So far this year, to date, we've had a total of 4 babies die before their first birthday. Same time last year, we had 10 babies. So we're seeing the numbers overall come down. But then when we look at unsafe sleep related, last year at this time, we had 7 deaths due to unsafe sleep.
7 out of the 10.
7 out of the 10. And so far this year, we've had 1 out of the 4. So we're seeing, that's incredible results to see in 1 year. So we are super excited about that. We know that the job is not done. We still need to reach moms and families and caregivers in our community so that they're all aware of that. Because sometimes it's generationally, right? There's a lot of sort of co-sleep. I can remember when I was little and my mom saying the same thing to me. It's like, oh my gosh, first it's on their back, then it's on their side, then it's on their tummy. So, what is the message around how babies should sleep? And we've learned things. So as we've learned, you learn more, you do more. And so we've learned what is best and really is on their back.
Are we doing better at getting moms into prenatal care?
Yeah, we still, I think, have an opportunity there for more improvement. I think that when we talk about the difficulty, not only on an access standpoint of moms getting into care, but opportunities for them to get into care, we need to do a little bit better of job of getting them into early prenatal care. We know the earlier moms engage in prenatal care, the better those birth outcomes are. From low birth weight to preemies to all of those things. We want moms to carry full term. So we do still need to work on that.
And the other one that we led the state in, lucky us, was obesity. Are we making any strides there?
Yeah. So obesity is something that is kind of a little bit more difficult to measure. Because unless you've been to the doctor and your calculated BMIs, and so it doesn't capture everybody, but we have ranked number 1 as the most obese county in the state of Michigan. But through, again, efforts of Be Well and having, talking to providers, creating resources for them when they're talking to their patients, who want to live healthier lifestyles or lose weight. And then also encouraging people that when they go to their doctor to have a conversation if they are worried about it. So providing tools and resources on both ends. And so we're seeing that we've made some progress in these areas, not to mention just healthy lifestyles. We've done a lot in the podcast to do education, using people right here in our community to tell their own story of their journey, because health is, it's a marathon. It's not a sprint, right? And so those pieces take a long time to do, but we are seeing that we're making progress. And right now, we're not the most obese county in the state of Michigan. We might be the 3rd, but hey, we're moving down, and that's what we want to do. Absolutely.
I always kind of chuckled at it. We've had for decades and decades, we hear about the food tree and how we should be eating and all of that, and you talk to doctors who took their education decades ago, maybe they had one class on nutrition, maybe. That's changed now in medical education. It's become more important. So now some docs, particularly the newer docs, can talk about it, know what they're talking about. The docs that have been around for decades, they never took it. They,
Right.
So
Yeah. I mean, the nutritional component of how we train our physicians and what they go through now, there's even from a public health standpoint, there's a lot more opportunities for them to understand that they do play a role in their patients' overall health, wellness, and well-being.
all right, we're going to take a quick last break, come back and finish up as we chat with Christina Harrington from Saginaw County Department of Public Health. She is the county health officer. Doing to protect their youngsters this time.
Well, anytime we're, getting back to school, we see my kids even say it, like, oh, there's something going around now. All the kids are sick, right? We know that in those environments, just as during COVID, it was a little difficult, right, to sort of limit the spread when you have people,
But
and
that's such an anomaly.
Yeah.
I mean,
yeah, it is. It is. And it's, not anything that we can entirely get away from. But just, I think one of the things that has always been a tried and true public health message is, teaching kids the importance of hand washing really does go a long way. So as much as, like we touched in the beginning about being, up to date on our vaccinations is one of the tools. Hand washing is another really important tool. And I think that we don't, during COVID, we did pretty good. And I said, if there's anything good coming out of, the spread of COVID, was that our kids did a really good job with hand washing.
well, they were afraid. They had something to be afraid of.
Yeah, true. And so were, schools in general, right? So the teachers, they were taking hand washing breaks. We were, sanitizing, surfaces. Those things are all tools in the toolbox that are important. So I think the younger that our kids recognize their own responsibility for hand washing and covering our cough or sneezes, as we were talking about earlier. Those are all strategies that can keep not only themselves healthy, but then others around them too. So we're going to be coming in time of respiratory season as well. So, it used to be get your flu shot. And so stay up to date on those because they are tools that help. And if we want to limit the spread and keep kids in school and keep kids healthy and families healthy, because let's be honest, and they come home and they spread it to everybody in their household. Those are all strategies that parents need to be mindful of as we go into the winter months and we're indoors and viruses like to circulate.
I saved this for last. I don't know why, but I did. We went through COVID. There was a lot of confusing information coming from the federal side of things. Do this, don't do this. Do this, don't do this. Get this, don't get this. As you look back on it as a health officer, from the time COVID was announced until it waned, it didn't go away, but it waned, would you have done anything differently?
Good question. I think that I would say probably, in that we didn't know what we didn't know, particularly early on. And
True.
If, we did 62 straight weeks of Facebook Live with Dr. Pruitt and I,
Yep.
literally taking questions and just being, trying to be responsive to our community's needs. And if you go back and were to look at all of those, we knew like that we didn't know what we didn't know, and we said it, right? So I think part of the political sort of fight that everybody got in was we were trying to make stances. And so sometimes we made a stance about something, and in 6 months, maybe that wasn't the same stance because we learned more. And so Dr. Pruitt always used to say that COVID was like a baby. Like, we don't know what we're doing. We're sort of paving the road while walking down it because it was a novel disease and there were things that we just didn't know about it, how it was going to behave, how it was going to spread. So I think that the short answer is, yes, there's probably things that we now what we know, we would have done things a little differently. But I think that for us in Saginaw, one of the great things that we would not have changed was the partnerships that forged because of it. So we really have a community on competitive healthcare in our county that is working together in ways that they weren't